Blog Talk Radio.
Jenny Hatch Show at Blogging Mothers Magazine. Today I'm going to read an article that I wrote for the magazine called Homebirth Hooey and Hokum. First, let's start with the definition of hooey. Silly or worthless talk, writing, ideas, nonsense, bunk. Synonyms for hooey include nonsense, BS, bunk, rubbish, drivel, bull, pish, tosh, horse hockey, tommyrot, balderdash, malarkey, foolishness, bunkum, huey, hogwash, poppycock, bilge, absurdity, babble, baloney, bananas, blather, bombast, bunk, claptrap, fatuity, flightiness, folly, garbage, gibberish, giddiness, hot air, imprudence, inanity, or irrationality. Hokum. The definition of hokum is misleading or being dishonest. Synonyms for hokum include beguilement, betrayal, blarney, boondoggle, cheat, circumvention, craftiness, cunning, deceit, deceitfulness, deceptiveness, defraudation, dirt, disinformation, dissimulation, double-dealing, dupery, duplicity, equivocation, falsehood, fast one, flim-flam, fraud, fraudulence, guile, hokum, hypocrisy, imposition, insincerity, juggling, lying, mendacity, pretense, prevarication, snow job, sophism, treachery, treason, trickery, trickiness, trumpery, and untruth. Here's the article. Homebirth, Hooey, and Hokum. The American College of Obstetricians and Gynecologists are dealing with an increasingly incredulous birthing population who are rejecting their style of knock-em-out, drag-em-out childbirth. The young female birthing population is increasingly turning to new media for sources of information regarding childbirth, vaccinations, and psychiatric care, and the medicos do not like having their monopoly broken up. So a new home birth study in the form of a blatantly politicized piece of propaganda has now been published attempting to prove that home birth babies have a threefold increase of death over hospital-born children. The Globe and Mail reports the U.S. analysis on home birth risks seen as deeply flawed. The new study suggests more babies die during deliveries at home than in hospital. The doctor who produced some of the data calls the conclusion sensationalist. A new study by U.S. researchers questions the safety of giving birth at home, suggesting that more babies die during home births than during hospital deliveries. But Canadian researchers whose data were extracted and used in the study say that conclusion is deeply flawed. The meta-analysis of 15 studies led by Joseph Wax of the Maine Medical Center's Department of Obstetrics and Gynecology found that giving birth at home tripled the risk of neonatal death. Patricia Jansen, an associate professor at the University of British Columbia's School of Population and Public Health, says that conclusion is sensationalist and based on data that are in some cases decades old, on very small samples, and in some cases incomplete. Canadian midwife Gloria LeMay wrote on her Facebook page, "I was called by the press today to give a comment on this, quote, breaking story. Why do these people get press and we can't get press to expose the horrific induction rate?" Midwife Wendy Gordon wrote on Gloria's Facebook wall, "I just took a look at the meta-analysis and the authors cherry-picked studies from all over the globe to give them the results they wanted. The only studies included from the U.S. were Wax's own meta-analysis of morbidities published earlier this year. He didn't analyze deaths at all in that study. The infamous PANG study that is notorious for including unplanned home birth and preterm births, and some random study of a home birth practice in rural Sonoma County published in 1984. The excellent Johnson and Davis home birth study from 2005 was not included. The other studies were from Canada, 6 studies, Australia, 4, Netherlands, 4, the UK, 2, and Sweden, 2. Scotland and Switzerland both had 1 each. Wax's conclusions really don't say anything about the safety of home birth in the U.S., and frankly, the results aren't generalizable anywhere on the planet since the healthcare systems and midwifery care are vastly different among the countries analyzed. What a ridiculous analysis. The Big Push for Midwives group sent out a press release in response to the study. It is linked below. And if you'll go to bloggingmothersmagazine.com and click on Homebirth, Hooey, and Hokum, you can go to this PDF of the press release. On the ICANN blog, several quotes from the press release are shared. Increased risk of home birth is pure fiction. 7th July 2010. The Big Push for Midwives released a statement today in response to publicity surrounding a forthcoming article in the American Journal of Obstetrics and Gynecology that claims to show home birth is unsafe. From the press release, as New York and Massachusetts move to pass pro-midwife bills in the final weeks of their legislative sessions, the American Journal of Obstetrics and Gynecology fast-tracked publicity surrounding the results of an anti-homebirth study that is not scheduled for publication until September. Described as unscientific and politically motivated, the study draws conclusions about home birth that stand in direct contradiction to the large body of research establishing the safety of home birth for low-risk women whose babies are delivered by professional midwives. The release further quotes Dr. Michael C. Klein. Many of the studies from which the author's conclusions are drawn are poor quality, out of date, and based on discredited methodology. Garbage in, garbage out, says Michael C. Klein, MD, a University of British Columbia emeritus professor and senior scientist at the Child and Family Research Institute. The conclusion that this study somehow confirms an increased risk for home birth is pure fiction. In fact, the study is so deeply flawed that the only real conclusion to draw is that the motive behind its publication has more to do with politics than with science. Several days ago, Amy Romano at Science and Sensibility expressed her own doubts about the study, highlighting these points. 1, the meta-analysis is compromised by the inclusion of a deeply flawed study that relies on birth certificates and includes preterm births, unplanned home births, and home births attended by unqualified providers. In the only analysis in which the researchers excluded this study, the significant excess of neonatal mortality disappeared. The meta-analysis number 2 also includes studies that report on births that took place as early as 1976. The Big Push notes that the timing of publicity initiated by AJOG, the American Journal of Gynecology, is questionable at best. Given the fact that New York just passed a bill providing autonomous practice for all licensed midwives working in all settings, while Massachusetts is poised to do the same, the timing of the study could not be better for the physician groups that have been fighting so hard to defeat pro-midwife bills there and in other states, said Susan M. Jenkins, legal counsel for the Big Push for Midwives campaign. Clearly the intent is to fuel fear-based myths about the safety of professional midwifery care in out-of-hospital settings. Their ultimate goal is obviously to defeat legislation that would both increase access to out-of-hospital maternity care for women and their families and increase competition for obstetricians. The Globe and Mail ended its analysis of the study with these words: the U.S. analysis on home birth risks seen as deeply flawed. Michael Klein, Emeritus Professor of Family Practice and Pediatrics at the University of British Columbia, says the analysis and its conclusions has to do with the climate in the United States around midwifery. It is less acceptable by the medical profession there than it is in Canada, he said. We are dealing with a politically motivated study, said Dr. Klein, who was a co-author with Dr. Jansen on the BC study. Dr. Wax could not be reached for comment. His study was published Thursday in the American Journal of Obstetrics and Gynecology. Dr. Wax's study is being ballyhooed around the